my name is Audrey Cawthon, and this is my presentation on National Patient Safety Goal, reducing the risk of healthcare-associated infections. So healthcare-associated infections can be very costly and harmful to the patient. The 5 main types of healthcare-associated infections are ventilator-associated pneumonia, catheter-associated bloodstream infections, urinary catheter-associated infections, C. diff, and surgical site infections. Hand hygiene can be the first step to preventing healthcare-associated infections, so it's very important to emphasize how important hand hygiene is to our nurses. The importance of the goal is reducing healthcare-associated infections so you can improve the patient's health and safety. How change might improve the patient outcomes. Reducing healthcare-associated infections can decrease patient stay at the hospital. Whenever a patient gets a healthcare-associated infection, it increases their length of stay at the hospital and it increases their cost of their stay at the hospital. So it's really important to try to decrease these as much as we can and do as much as we can to prevent healthcare-associated infections. Case study I read was healthcare-associated infection. Hospital-acquired infection costs $10 billion a year. It was a study that I found online, and they studied the 5 different types, and they were saying that 1 in 20 patients at a hospital acquire a hospital-acquired infection. So they were talking about how the infection is really expensive to treat. So back in 2006, Medicare decided that they were going to stop paying for infections that were acquired during a patient's hospital stay. So now that cost is dropped on the hospital, so this kind of gives the hospital incentive to do as much as possible to prevent infection in the hospital. One of the articles I read was called Prevention of Healthcare-Associated Infection. It was saying healthcare-associated infections are the leading cause of morbidity and mortality among hospitalized patients. When decreasing healthcare-associated infections, we can decrease the time of the stay in the hospital, and ways to prevent the infections is educating the healthcare personnel, using proper hand hygiene, and using proper isolation precautions. So this article helped explain the different ways of how you could decrease hospital infections. Second article I read was Nurse-Physician Collaboration and Hospital-Acquired Infections in Critical Care. This article, they talked about hospital-acquired infections in critical care. The 2 infections that they discussed were ventilator-associated pneumonia and central line-associated bloodstream infections. And they were just saying the use of proper sterile procedure when inserting central lines is very important, and using proper oral care for patients that are on ventilators can help reduce the risk of them getting ventilator-associated pneumonia. Article 3 I read was use of patient hand hygiene protocol to reduce hospital-acquired infections and improve nurses' hand washing. So hand hygiene is very important and can significantly decrease the patient's risk of getting a hospital-acquired infection. Hospital-acquired infections are very costly, and most of them could be prevented. One thing that they talked about was the chlorhexidine gluconate baths that now are at our hospital. We give them to all patients that have central lines, and in this article they were talking about how they were trying to get it mandatory for all ICU patients. But those baths significantly decrease the patient's risk of getting central line or hospital-acquired infections. And those are my resources. And that's it.